I am so curious to pick your brain on some of these perhaps issues. I don't like to say issues, but maybe, things that aren't 100% with our bladder. For me, I feel like a couple different things, okay?
I'm ready.
I feel like there are some days where I pee 24/7, like all day long. And then I have some days where I finally sign off my computer at 5:30 and I'm like, wow, I have not even gone to the bathroom once today. And I think that mostly people attribute that to, are you hydrated? Are you drinking enough water? But I'm curious, what other reasonings could there be for why we may see a fluctuation in how much we release our bladder? And also, on average, how many times should we be releasing our bladder per day?
So, great questions. I'll answer the easy one first, which is how often should we be emptying our bladders? It's about 6 to 8 times in a 24-hour period.
Okay.
So every 3 to 4-ish hours.
Oh my gosh, that's a lot.
Is it?
I feel like it is.
Okay, we should talk.
Oh God.
So if you find that you are peeing a lot more than that, peeing a lot less than that, then there might be a little hydration issue. There might be a little bit more of a, incomplete emptying issue. Definitely things to talk about. In terms of what you're saying, so our bladders are creatures of habit. They know a lot of things that we don't even realize they know. So they know that if you're settling in for a long day of computer stuff and you're not really drinking and you have drinking fluid and you have a ton of meetings back to back, it's sort of like, okay, we know we're in it for the long haul here. It's sort of like, okay, we know.
It prepares itself.
But then other days, if you're like, oh, I'm running around or I'm drinking tons of water, then it's like, oh, we have the freedom to go pee. Like we have a little bit more leeway with this. I find that folks with a job that has so folks like teachers, maybe doctors, nurses who really cannot pee when they need to. Do you know what I mean? Because they're held by teacher can't leave a room full of students all the time, or doctors are no, we're busy, we're seeing patients all day long. Usually those folks have a really tough time with their bladder because that can be really hard to have a routine.
Okay, so I was going to ask this as well, because if these suckers are so smart, how come whenever I get into the car and I have a long ride ahead, that's when all of a sudden my bladder is like, I've got to pee. Have you ever, you've been on a road trip and it's just as soon as you get into the car, you peed before you left the house. You do not have to pee. And then as soon as you hit the traffic and the road, all of a sudden you're like, I have to pee and I'm going to pee my pants right this second. Is that more of just a mental thing, or is that our bladders doing something to us like fight or flight mode?
I need to say kind of both. So you kind of mentioned just in case peeing. Just peed before you leave the house, and it's sometimes you're I don't really have to pee, but I should just go.
Always.
Not the best.
No way. I've been doing it my whole entire life.
I know, we all have. So it's sort of basically our bladders like to be consistent. It likes to be filled to a certain amount and empty a certain amount. Fills, empty, fill. It doesn't like to it doesn't, how you said, some days I'm really dehydrated and I don't drink water. It doesn't love the big changes day to day. So just in case peeing is, guess what? You telling your bladder you have to pee. It's not your bladder telling you. Honestly, you've been to brunch or something with your friends and you're having a great time and someone's like, oh, I got to go to the bathroom. Does anyone else have to go? And someone's like, oh, yeah, I guess so. Yeah, might as well. We can always go pee. So there's always going to be something in your bladder, but it might not be ready to be completely emptied. So that can maybe create not a great habit. And then on a road trip, sometimes it can be hard to distract yourself, right?
Yeah,
you're
definitely.
You're okay, when's our next rest stop? And you start to think about it a little bit more. Yeah. And then that can just sort of heighten your awareness of your bladder and its needs.
So would I be totally off to make the analogy, when you were just saying that about our bladders, the first thing that came to my mind is our like cell phone batteries. You know how they would say let the phone completely die before you charge it, because over time, if you charge it with 10% left or 20% left, it starts to lessen the life of the battery because it's like thinking that it's fully charged when it's not. You know what I mean? Is it something like that with our bladders where like if we're releasing it too soon, our capacity or the memory of our capacity can kind of change where we think it's full when it's not?
Actually, such a great analogy that I've not heard before. I really don't know how phone batteries work. Like, I literally don't know.
I think they've come a long way, but that used to be the case. Like, if you charge your phone too soon, you would shorten your battery life because it's thinking that 70% that it needed to charge is actually 100%, you know?
Yes. So, actually, that's a great analogy. So, all those times you just in case pee, your body's like, oh, her bladder is only like a quarter full right now. Like, I guess we're kind of full. I guess it's time to empty. So it doesn't really understand that that's not full, and it'll give you maybe a fake urge later on. Mm-hmm. So it can be really hard for people to decipher, like, was that a real urge or was that just sort of like a... So basically the way our bladders work is it's like a balloon that fills with fluid. So about your bladder can fill about 2 cups of fluid, okay? So let's say your bladder capacity is different than mine, different than the person walking down the street, but on average. So the thing is, before it ever gets to that 2 cup full, about 1 cup, it's like, hey, Tracy, like, we're in Target right now. You have a full cart. Maybe it's like time to go to the checkout line. Yeah. You know, like find the bathroom, right? It just gives you a little bit of like a heads up, right? Yeah. It's not like a ding, you gotta go. We've been there before, but it's not like it, you know? But usually it's like ding, okay, like kind of get a lay of the land, and then, okay, let's make it to you have time to make it to the bathroom. Mm-hmm. However, if you kind of listen to that signal, that 1 cup mark forever and ever and ever for like months, it's going to start to think like, oh, hey, Tracy, like we're full. Like we're nearing, like 1 cup is full now. And that's what it, like that capacity you were talking about with the battery. It's sort of like, oh, I think that it starts to think that 1 cup is full. So then guess what? At half a cup, it's going to be like, oh my gosh, we're halfway full. So it can get really confused in terms, like our bladders are smart, but they really base it off of routine. It's basing it off of what you've done before.
And so with physical therapy, there are certain, whether it's, I don't know if it's exercises, stretches, treatments, all whatever terminology, but there's different things that we can do that can hopefully reverse some of that bad training that we've done to our poor bladders.
Literally bladder training.
Okay. That's actually really reassuring.
Yeah.
Another layer to this that I think is interesting is you mentioned, sometimes you can feel like an urgency to go to the bathroom, or maybe have a hard time going to the bathroom if you're constipated because of how close our rectums and the bladders are to one another. I feel like personally, when you're drunk and you've had too much to drink, right? You have an issue with fully emptying. You go pee, and then as soon as you get up, you have to go pee again. And we all call it like you broke the seal, right? But then also times on our menstrual cycles, or like if you're having trouble going to the bathroom, number 2, we can have issues with peeing. How does that all come into play? And can we have these sort of moments where we have maybe more difficulty based on these other factors that go on?
Definitely. So alcohol is definitely a bladder irritant.
Okay.
So it's like basically if it's getting in your bladder doesn't love it.
Yeah.
Okay, so it's more like, okay, it's here, let's get this out. And a lot of times when we are drinking, we're not also hydrating, right? We're like with water, right? We're just like drinking. So, or alcohol, I should say. And so that can just get more and more irritating to our bladders. And our bladder's like, oh, okay, it's time to get this out. Mm-hmm. Time to get this out. So that can lead to that increased urge to pee. And then your other question, time of the month. Yes. So things can change. Honestly, our hormones are wild. our hormone levels change day to day, and it's just kind of crazy. So like during ovulation, during menstruation, like all those things can definitely cause differences in our bodily function, right? Even like you feel like fatigued, sleepier, or like stomach upset, like all those things, they can be somewhat on the normal spectrum. Of course, if you're in pain, if you're, really having difficulty with some things, of course, that's something to like kind of talk to your providers about. But there is like a somewhat normal range of changes through your body during all these hormonal shifts, definitely.
Okay. So more often than not, when people have an issue with urinary retention, is that more of a systemic thing going on, or is it one of those things that sort of comes and goes based on these other contributing factors?
It can be so many things.
Yeah.
There could be a pelvic floor component, meaning like you're not emptying completely. You're sort of like your muscles are kind of holding on and like tightening that tube, so like it's not completely emptying. If you have a history of just like holding your pee for a really long time, your bladder might not be able to get everything out. And then a lot of people tell me like, oh, it feels like I don't completely empty because I have to pee again like 20 minutes later. But that's also like, remember what I said about your bladder it starts to read those signals wrong. We can always go pee. Yeah. But sometimes the urge or that sensation you get is a little bit off. So that might not be a urinary retention issue. It's just like an urgency issue. But yeah, urinary retention definitely happens to people. And then that's something that we want to make sure we're talking about. Like, do you get UTIs? Do you get anything else going on? Do you get any sort of irritation going on down here?
Yeah.
So talking about all those things that might kind of come along with it too.
So for someone who has that pretty consistent, or maybe it happens often, something like they have this immediate frequency, right? They feel like they got to go and they got to go right now, but it's not a UTI. They don't have other UTI symptoms. Based on the lovely display that you gave us earlier, that might have something to do with that layer of muscle that helps with the urinary control.
Yeah.
Okay, so it could be a bunch. There's a boatload of different things.
Boatload. Like, are you hydrating? Are you only drinking bladder irritants?
Yeah, which is why it's so important to really go in and get checked out based on your individual concerns, because everybody, I think that there, like we said, it's a beautiful thing that like there's so much of this conversation happening online, but it's so overwhelming when one person tells you one thing, one person tells you another, and sometimes it's like, okay, well, I get that the more holistic or functional doctor is going to say something then different than the Western medicine doctor. But then you get into a point where it's like two women who both specialize in female reproductive health, and they're saying the opposite thing. So it's like, wait a second, you guys are supposed to be on the same page. It's very difficult to know who to believe, what information to trust. And that's why we've got to stop self-diagnosing ourselves on the internet and go into a specialist who can help you properly. Yeah. That being said, though, do you have one little either tip, trick, exercise, little something other than a Kegel that people could do at home that you might just want to, like, you think might be good for everybody to just do? Stay on top of.
Oh my gosh. Fun. One thing that I find all the time is take a deep breath.
Oh.
And hang on.
Oh. You're like, I'm not finished yet.
Yeah, I'm not finished yet. But let your belly go. How often do you find yourself actually like gripping your belly, like without even noticing? But like we wear high-waisted jeans, like love them. We'll wear them forever. No low rise, please. But how often do we just kind of suck it in without even realizing? How often are we engaging our abdominals and just clenching? Especially as females, we've been told our whole lives, like suck it in, like tighten fit. A lot of times if we're really just tightening all the time, we're also just like tightening our pelvic floors too. So we want to make sure that you don't really need to be tight all the time. Like, okay, like take that deep breath, but let that travel down to your belly and like let your belly go. I feel like that's a big one that is so underrated. In terms of when I teach people about the pelvic floor, I teach them about their abdominals, their breathing, all that stuff too. You really can't just talk about the pelvic floor without talking about all of that stuff too. So I know I just open a whole new box of worms there. But if you're listening to this, think about oh, was I clenching without me even realizing? Let my belly go. What's wrong with that?
Yeah.
I feel like that's a big thing, especially in our society where we're always told